Which way now?
You're gonna make a left at the common carotid artery?
It looks like we have ended up on the left side of the head and neck.
Back up. Which main road is this?
This is the Aortic Arch.
Okay, straight ahead you'll see the brachiocephalic trunk.
I see it. Taking it now. Looks like we've ended up in the right arm.
No, back up, this is wrong.
Okay, I'm back on the main road, Aortic Arch.
We're looking for the common carotid artery. Make a right up here.
I'm here, but we have to come to a fork in the road.
A fork in the road?
My choices are external carotid artery and internal carotid artery.
Let's just stop and ask for directions.
No, I'll figure it out.
The other branch of the brachiocephalic trunk is the right subclavian artery. It is inferior to the clavicle or subclavian and supplies the upper limbs.
Upper limbs? You mean our arms, right?
Yes, that's right.
Look, guys, my right subclavian artery is getting its supply on.
Is there a left subclavian artery?
Yes, there is. The left subclavian artery branches off the aortic arch. Branching off the right and left subclavian arteries is the vertebral artery. This artery is a rather deep vessel and will contribute to the blood supply of the brain after coursing through the transverse foramina of the cervical vertebrae. Another branch of the subclavian artery can be seen descending down the posterior side of the rib cage. This artery is called the internal thoracic artery and will provide blood supply to the anterior chest wall. As we continue to follow the subclavian arteries toward the arms, we enter into the axillary or armpit region. The artery found in this region is the axillary artery. It is a continuation of the subclavian artery after it passes the clavicle.
My clavicle's right here.
Nice work. The axillary artery continues as the brachial artery after it passes through the teres major muscle. This artery descends down the medial side of the humerus between the biceps brachii muscle and the triceps muscle, then branches or bifurcates into two arteries in a region on the front of your elbow called the cubital fossa.
This is getting to be a little overwhelming.
Well, it may seem a bit overwhelming, but these arteries are very important to our survival. Like I was saying, two arteries branch off. One is called the radial artery. This descends down the radial side of the arm and supplies blood to the forearm and hand. Another branch is the ulnar artery, which descends down the
ulnar side of the arm?
Correct. This ulnar artery supplies the forearm and the hand.
Oh, I can't move on. There's too many arteries to remember.
You gutless little turd, you will learn these arteries. You will learn every last one of them. Do you think you know enough, Private?
No, sir.
No is the answer, Private. You haven't learned half the arteries yet. You need to get pumped up, Private. You need to have heart. I need to see these terms flow through your vocabulary. You need to be able to locate their position and keep up the pace. In fact, you need to be a pacemaker. Now, how many puns was that, Private?
4 puns, sir. 5 if you count gutless, sir.
Yeah. Now, keep up your head and learn those arteries.
Yes, sir.
Cavity between the ribs, we can see the intercostal artery. We will now shift our discussion to the arteries that branch off the descending aorta.